Kathleen Roche. I'm an associate professor at the Milken Institute School of Public Health at George Washington University. So in November of 2017, we conducted a survey and some focus groups with U.S. Latino parents raising adolescent children. In the survey component of that research study, we asked parents a series of questions for them to respond to the ways in which they have experienced recent changes around immigration actions and news. And we've also administered to them a questionnaire that's a standardized questionnaire assessing clinical symptoms of depressive symptoms, anxiety, other mental health problems. About a third of our sample were undocumented, but the remaining were all legal residents or citizens. So this includes permanent residents, those with temporary protected status, and U.S. citizens. So we weren't surprised to find, of course, that many parents in the United States in this study appear to be having both mental health problems and experiencing very adverse responses to the changes around immigration policy that have gone on since the election of this president. What struck us in our findings was the degree to which parents with legal residency status, whether that be temporary protected status or permanent residency, were experiencing very adverse impacts from these immigration events. So we found that high proportions of parents, almost half of parents actually, were doing things very often or always warning their children to stay away from authorities such as the police. They talk to their children about changing their behavior, such as where they hang out. And these are all adolescent children, so these kids need more autonomy during these years, but they're being warned by parents to curtail their behaviors because of the fear of immigration threats. Parents experience frequent worry about family separation. 2/3 of the parents in the entire sample report that they very often or always worried about family members being separated. Parents frequently are avoiding getting medical care or getting help from the police, or seeking assistance with public services that they are eligible for. So these adverse impacts were experienced across a range of behaviors. They certainly were elevated among the non-U.S. citizen group, with one important exception, and that is for the parents' report of being frequently stopped, questioned, or harassed by immigration authorities. About 14% of the parents in our study reported this experience frequently, regardless of whether or not they were a U.S. citizen or had other forms of legal status or were undocumented. These adverse responses to immigration were all strongly tied to parents' odds of experiencing high levels of psychological distress, as indicated by elevated depressive symptoms and anxiety. The increased risk ranged from a low of 200% greater odds of experiencing high levels of distress to, in some cases, 5 to 10-fold higher odds of experiencing psychological distress. So when parents did things like warn their children to stay away from authorities, or they themselves worried that their child would not be able to complete school because of these immigration events, or worried about their family being separated, they had this very elevated, increased odds of experiencing or reporting depressive symptoms and anxiety. As I indicated earlier, our study was conducted in November, and while there were many immigration events going on and being covered by the media, those have only increased now in this recent month, with images of young children being separated by their parents and audio recordings of children calling for their parents. And our research back in November suggested that it was indeed in many ways the exposure to media coverage around these immigration events that were causing parents to have fear, parents across diverse residency statuses. And our concern now is that those mental health problems and those worries are only going to be exacerbated by what's going on today. One of the things that really struck us in this study is that U.S. Latino parents with permanent residency status who are not and never have been officially targeted by these official actions by the Trump administration, they have reported in many ways adverse responses that are no different at all from undocumented parents. So the proportion of these permanent residency parents who report things like warning their child to stay away from authorities, or who are avoiding seeking medical care services themselves, those are not any different than the undocumented parents. So our concern is that there are, a few groups maybe targeted officially by the immigration policies, but that the adverse consequences then seep into the lives of many U.S. Latino families throughout the country. And 75% of the adolescents whose parents were included in this study are U.S. citizens. And the remaining 25% have protection under the Deferred Action on Childhood Arrivals program, known as DACA, or they have eligibility for DACA. So the fact that we're seeing such adverse impacts on U.S. citizen children's parents and on parents with legal residency status is a concern as we move forward, because these kids comprise a large proportion of the U.S. population, and they are the future of our workforce. And if they suffer because of their parents' own mental health problems, the kids themselves then will have trouble in school, have their own mental health difficulties, and then that compromises the future of this country in terms of our productivity and our workforce.